Hey everyone, today we're going to talk about autism spectrum disorder, and we try to give you a brief information, and I hope it will be okay. Next slide. Okay, introduction. Autism spectrum disorder, ASD, is a complex neuro and overdevelopmental mental disorder characterized by social communication and interaction difficulties, repetitive behaviors and interests, currently classified under a single broad category in the Diagnostic and Statistical Manual of Mental Disorder, DSM-5, since 2013. It means that there is no other characters of autism. It's only on one spectrum. A little bit of history previously. Okay, a little bit of history overview. In 1943, Leo Kanner described early infantile autism, which is described as parents describe their children as being like in a shell or not communicating with them in early years. In 1944, Hans Asperger's described similar syndrome, but in adults, which focused on lack of communication abilities and even high levels of IQ. In 2013, as we said, DSM-5 unifies autism subtypes into ASD. It means every autistic characters that was until then is being now under one spectrum disorder. Yeah. Okay. Etiologically and diagnosis. Casual factors. We know that there are genetic factors in a high probability. It means that now that we know about many genes that are responsible for autism, but we don't have enough research to know exactly which one is acting in order to make this disorder. Environmental, advanced parental age, especially with male. When a male is older, then there is a lot of chances that his child will be with autism. Pregnancy complication, exposure to certain infections or toxic during the pregnancy. And of course, there are unknown factors that the complex interaction between genetic and environmental factors, they are not yet fully understood. Diagnosis now is in a clinical way, ADOS, Autism Diagnosis Observation Schedule. It means that we are doing observations, and we see inside. What?
It's a questionnaire, the ADOS.
What do you mean a question?
שאלון.
It's a questionnaire and also תצפיות, observations.
Yes.
Yeah. And of course, we can do a diagnosis according to the DSM-5 criteria, which is, we will now talk about the characteristic of that are we can see on autism spectrum. Before we do that, we want to establish the prevalence and demographic. The prevalence, global prevalence, about 1% of the population. In Israel, about 1 to 15 children, similar to the US. And there are also significant increasing in diagnosis in recent decades. It means that more and more diagnostic that are coming in the last years. Sorry, my English is not very good. Factors affecting prevalence. We know that male are more likely to have autism than female. It's possible that the number is lower due to the different symptoms that women present than men, or it can be genetical. Ethnicity, this part it's difficult to do it. Disparities in diagnostics exist between different ethnic groups due to healthcare access. Many groups doesn't have healthcare access, therefore they are not being diagnosed Doesn't mean that they have lower rates of autism. Geographic region, it's also similar difference in diagnostic rates between countries and regions, primarily due to awareness that they don't know that they need to get checked, and access to diagnostic service. Next slide. Okay, physical and cognitive characters. So first of all, we cannot see on the person on the outside that he has autism, not unlike other like no. There are no unique traits, but we can see behaviors that appear differently, like stereotypical movements, hand flipping, head rocketing and body rocking, sensory sensitive to sound, to touch, to light, and difficulties with fine and gross motor coordination. Okay, it's very hard for them to do everyday things that we do. Cognitive, wide range of intelligence abilities. Approximately 30 to 40 have intelligence disabilities, but there are about 30% that are above average or average intelligence. Difficulties with theory of mind, which means to understand other people's thinking and feelings, and executive function, like planning, cognitive flexibility, self-control, problem solving, and different information processing. It's when people with autism has accepting information from the environment, it's usually based on visual and not only not with other senses. Okay, we can go through it. And the behaviors that we can see, it's difficult in social communication, as we already said, and interaction, repetitive behaviors and interests in specific topics, difficulty adapting to changes and insist on routines, atypical responses to sensory stimuli, sometimes emotional outbursts and challenging behaviors that can also be violent. Implication of behavior analysis. We as a behavior analysis have challenges with treating with autism because of the high variability among individuals with autism. And then we know the saying, if you met one person with autism, you met only one person with autism, and everyone is different. So we need every time to understand and know the person that is in front of us. Difficulties in communication and understanding instructions. This is a problem when we built a plan for our customers. They need to understand what we want from them, and we sometimes need to have a lot of patience with our clients. Sensory sensitivities that affects behavior. The behavior is not always something that we can predict. It can be also something that we don't know why it appears, and the behavior can be difficult even with the light. There is too much light, too much noise that affects all the learning processing. Challenging behavior that may be communication in nature. Sometimes when people with autism want to communicate, they have a lot of trouble doing it with words like we do, and therefore even challenging behavior like violence can be communicative, but we don't know how to communicate with this. Okay, possible intervention strategies. So of course, ABA-based intervention, applied behavior analysis, functional behavior analysis, structured teaching, DTT, incidental teaching, functional communication training. You think we should
No.
להרחיב על זה? No, okay. Additional intervention, TACT, program emphasize visual structure and an adapted environment. Ma?
Teach.
What?
Teach.
Yeah. Okay. PACS, picture exchange communication system, and DIR, floor time, and development approach focusing on the interaction based on parents and child interaction. Adapting reinforcement method. Identifying effective reinforcement. It's especially important when we think about the individual and what drives him. Using natural and functional reinforcement. Adapting a manner of reinforcement delivery immediately or continuous. Being cautious of statization, avoidance of reinforcement, not to give too much of the
Reinforcer.
yeah, reinforcer. Thank you. Ethical consideration. We want to emphasize autonomy and choice to the person that we're working with, respecting sensory preferences and areas of interest, focusing on functional and meaningful skills, avoiding suppressions and stereotypical behaviors that are not harmful when they need these stereotypical behaviors, and if they're done don't harm the environment, we don't want to mess with them because it's something that helps them. Involving the individual and his family in planning and setting intervention goals to make him a participant in this process and in the learning process and in making his life better. Galit,
Yes, I'm
you can take.
1 second.
Yeah,
Why?
you can take it from here. We want to now
okay.
show a case study and discuss it, and Galit will be the one who leads.
Okay, my
Thank
English is
you.
not that good as Naama's English, but I will try. Okay, so a little bit of like a comment background we thought about. Let's say a boy that is 6 years old, and we decided to name him Yoni. That's diagnosed with ASD at age 3. Yeah, he has single words and he uses pictures for communication. He shows interest in numbers and vehicles. He has difficulties with transitions between activities and challenging behaviors during frustration, crying, meltdown, tantrums, throwing objects. The challenges that he deals with is a difficulty integrating into a regular classroom. The parents struggle at home to deal with him with his outbursts at a frequency of 10 times a day. And he has a sensitivity to noises in school environment. The intervention that we know that is useful for this kind of profile and challenging behaviors is, of course, to start with a functional analysis. Let's say that in this case, we can find an escape function. And we mean that he's showing his problem behaviors as a request to end activities or avoid noises. What is reinforcing the problem behavior is escape. So after we discover what is the purpose of the behavior and what is the reinforcer, we think about making an individual reinforcement plan to use his interest in numbers into the learning. We can make for him a visual schedule that will prepare him for transitions. We can use FCT, a functional communication training, to teach appropriate ways to escape when he need to escape, he want to escape, and to express what he needs. And also, we thought about environmental adaptations like noise canceling headphones or a calming area. The results we predict for this kind of intervention is to reduce in, let's say, 70% of the challenging behaviors, to reduce the frequency to like 0 till 3 times a day. We predict that we will see an improvement in the communication abilities. There will be more words that will be added to the how do you say אוצר מילים?
Vocabulary.
His vocabulary. Okay. We predict to see improved ability to adapt to transitions. And we also predict that the parents will report on a reduced stress at home. That will be it for today. Thank you for listening.
Thank you.
And goodbye.
Bye-bye.
Damako, this is your cue to stop the recording.